Hello, my name is Farah Majdalawi and today I will be presenting this case report. To begin with, I will be talking about the patient's history and her chief complaint. The patient is 20 years old. She is a married woman who tested positive for HIV. She has presented to the clinic complaining of a painless swelling on the heart palate, which appeared 2 months earlier. The patient has been postponing her antiretroviral therapy for the past 4 months, despite her positive testing for HIV. During extraoral examination, the patient's cervical lymph nodes were palpable, as you can see in this figure. Her lymph nodes were firm and non-tender on palpation. Intraorally, a diffuse bluish-red nodular enlargement was observed on the left side of the heart palate. This swelling was extending from the anterior area to the tuberosity posteriorly. This nodular enlargement was also crossing the midline, and thus it involved most of the heart palate, and it was interfering with mastication. Upon palpation, the swelling was firm in consistency, non-tender, and showed surface ulcerations. When a panoramic radiograph was taken, there were no significant changes in the adjacent bone. Moreover, there were no lesions in any other region of the body detected that were similar to the ones seen intraorally. When it was finally time for them to reach a diagnosis, they had three differential diagnoses possible. The first one was Kaposi's sarcoma, followed by bacillary angiomatosis and lymphoma. In order to reach a final diagnosis, an incisional biopsy had to be taken for histopathological examination. Under the microscope, fibrous connective tissue stroma with several irregular slit-like spaces containing extravasated red blood cells were seen. These were also surrounded by ill-defined vesicles of spindle-shaped cells. Chronic inflammatory cell infiltrate was evident beneath the surface epithelium. All of these features would confirm the diagnosis of Kaposi's sarcoma, in addition to the fact that this patient tested positive for HIV. To begin with, I will be talking about the patient's history and her chief complaint. The patient is 20 years old. She is a married woman who tested positive for HIV. She has presented to the clinic complaining of a painless swelling on the heart palate, which appeared 2 months earlier. The patient has been postponing her antiretroviral therapy. I would like to briefly talk about the background of Kaposi's sarcoma and HIV. Before the AIDS epidemic, Kaposi's sarcoma was actually considered to be a rare tumor. Most of the patients affected were homosexual men infected with HIV. However, heterosexual males and females can also be affected. During its early presentation, Kaposi's sarcoma is usually presented by flat reddish-purple discoloration. As the disease progresses, in the later stages, it is characterized by a nodular appearance with or without secondary ulceration, and this was what we observed in the case presented. The course of the disease, just like any other disease, strongly depends or highly depends on the patient's immune system. Among the various clinical forms of Kaposi's sarcoma, the one associated with AIDS is actually the most aggressive form. Lesions are usually manifested as bluish-purple macules and plaques on the skin, particularly on the face and lower extremities. However, the oral mucosa, lymph nodes, and visceral organs can also be affected without any cutaneous involvement. Usually, the most frequently affected sites intraorally are the heart palate, the gingiva, and the tongue. It is also important to know that in 20 to 25% of the cases, oral lesions are usually the initial site of involvement. Sometimes they may also be the only site involved. They can even sometimes be the first diagnostic signs for a patient with AIDS. It is also worth mentioning that the etiology of the disease is unknown, but the condition is considered to be neoplastic in nature. Some theories suggest that Kaposi's sarcoma represents reticuloendothelial hyperplasia. Current evidence suggests that Kaposi's sarcoma is caused by human herpes virus 8. As previously mentioned, prognosis of the disease highly depends on its form and the patient's immune status. Kaposi's sarcoma is a progressive malignancy, which may disseminate widely into lymph nodes and various organ systems. The introduction of highly active antiretroviral therapy has greatly influenced the pattern of Kaposi's sarcoma incidence in people with HIV. However, It is not known if this improvement is actually because of the improvement in the host immune status or a direct antiviral effect against the herpes virus 8. It is evident that effective, highly active antiretroviral therapy decreases the incidence and the prevalence of Kaposi's sarcoma and causes the regression of already established lesions. But in the case previously discussed, the patient's carelessness with her treatment caused the rapid evolution of nodular lesions in the oral cavity.